are you?
Good, good. I think we have a few people that have joined. So, do we want to just start with introductions?
Sure. Yeah, so I'm Monique Bogni. I'm the Director of Integrative Nutrition and Health Coaching at Pelvic Rehabilitation. And, we're here to talk about how to make symptoms better for IC, right?
Yes, exactly. So, hi everyone. I'm Dr. Kapadia. I am a physiatrist or a physical medicine and rehab physician at Pelvic Rehab Medicine. And yes, we are going to be talking about interstitial cystitis today. Super common diagnosis that we hear in our field, as well as gets thrown around a lot as a kind of an umbrella diagnosis for people. So, hoping to shed some light on it today in terms of what it is, how it can be managed from both a medical standpoint and a nutritional standpoint. So, Monique, if you're okay with it, I'll just kind of go into a background of what it is, and then I'll hand it off to you. All right. So, interstitial cystitis, as many of you have probably heard, is also called painful bladder syndrome. And it's a kind of an all-encompassing diagnosis when people have urinary frequency, urgency, pain with urination, kind of for unknown reasons in terms of sudden onset. So they'll develop an urge to urinate, they'll empty their bladder, but then soon after they'll feel that urge to urinate again. And so it can be really disrupting to just kind of quality of life, and a lot of people are woken up in the middle of the night with pain in their bladder, the pressure, kind of the pressure sensation. And we see this a lot in the general population, but we tend to see it in people who have other inflammatory processes, such as endometriosis, fibromyalgia. We see it in a lot of patients who also have been diagnosed with IBS. Just anything that kind of increases that inflammation in the body and produces a lot of irritation around that bladder lining. So, if you've gone to your doctor and complained about pain with urination or urinary frequency, obviously the first thing that they'll do is run some tests in labs to make sure it's not a urinary tract infection, a kidney infection. And so this is kind of where it gets frustrating for a lot of people, because they'll have the same symptoms of a bladder infection, but their urine analysis, their culture, all the testing will come back negative. And so if this has happened to you, then, and your urine tests are repetitively negative, then it could be interstitial cystitis. And so to kind of give a background on how the bladder relates to the pelvic floor. So your pelvic floor is like a hammock or a sling, and your bladder rests kind of right along that pelvic floor muscle called the levator muscle. And that muscle wraps from the back, the tailbone in the back, to the pubic bone in the front. And so anytime your bladder becomes inflamed, irritated, just kind of under stress, it can irritate those muscles, nerves, blood vessels along that pelvic floor. And this is why we often see interstitial cystitis go hand in hand with pelvic floor dysfunction. So when we're talking about the causes of interstitial cystitis, pelvic floor dysfunction is kind of that chicken or the egg situation, where we don't always know if pelvic floor dysfunction caused the interstitial cystitis or if the interstitial cystitis caused the pelvic floor dysfunction. They can kind of go hand in hand. And unfortunately, there's not one cause to interstitial cystitis, but, a working theory is that when that bladder, the lining of your bladder is called the epithelium, when that becomes kind of holy or weaker, then a lot of those urine products can leak out and then inflame that bladder in turn, causing that interstitial cystitis, that inflamed bladder and the inflamed pelvic floor in general. And so, like I said, it can be disruptive to sleep, to lifestyle. A lot of people are unable to go out, do their social things in their life because they're constantly rushing to that restroom and having that urge to urinate. I've had so many patients tell me that I have to map out exactly where all the bathrooms are when I'm going out in public places. So it can be really debilitating to your lifestyle. And so what we try to do is kind of decrease that inflammation, kind of down regulate that whole nervous system that has gotten hypersensitized from that repetitive urgency and frequency and inflammatory processes. So I mentioned urgency and frequency, but other symptoms of interstitial cystitis that you may look for in yourself are so frequency, having to urinate repetitively, that urgency, that inability to hold that urine when you first feel the need to go to the bathroom. When you actually do urinate, there may be burning with urination, pain. A lot of people have told me it feels like pins and needles coming out of their urethra. And then that feeling of incomplete emptying of your bladder. So when you do urinate, you feel that you haven't actually emptied your bladder totally. And then tenderness around that bladder when you press on exam is something we also see. So like I said, interstitial cystitis, we can manage it with medications. We can manage it with trigger point injections to that bladder and to the pelvic floor muscles. But if we're not really getting to the root of the problem, then it's going to be something that recurs, over and over as inflammation increases in the body. And so that's where Monique comes in, because we are huge advocates of managing inflammatory processes like interstitial cystitis and all the other ones like endometriosis, IBS, through a nutritional, dietary, lifestyle management. And so, I'll touch on some things later as well, but Monique, how does nutrition relate to interstitial cystitis and the bladder?
Yeah, sure. Thank you for all that great information. So, foods we eat can contribute to inflammation or calm the system down. And so one thing that you talked a lot about is how the bladder area is really inflamed. So especially when that's happening, it's like we want to bring in those foods that are going to help to calm things down and soothe things, and, remove foods that are going to cause, flare-ups. So, a lot of people know about like the main inflammatory foods, dairy, gluten. Those can be a really big trigger for people with, chronic pelvic conditions. Even soy, corn, eggs for some people. So it's like, even like healthy foods aren't healthy for everybody at different times, depending on what's going on with their bodies. But for reducing inflammation, I always suggest bringing in more alkaline foods. So that's all the green stuff. So leafy greens, fresh, cold pressed green juices, green smoothies, fruit in general. If you can tolerate fruit, I know some people, they're really sensitive to fruit in the beginning because it's really cleansing. And that can kind of irritate symptoms at first, but, starting off slow and increasing to more can be really beneficial in clearing out, bacteria and viruses and things that are in there. And, even just steamed vegetables, and, not everybody can handle a salad. Their digestive system is compromised, and salads can also really, they go in there. But this is what I describe. Sometimes when you're eating a salad and it feels like, oh, I can't digest this, it's really that it's just scrubbing the intestinal lining. Right? Mm-hmm. It's like that fiber is just getting in there. It's just cleaning things up. But the nerves are really sensitive, right? Especially if you have something like this going on. So then it just might irritate the whole system. So then in that case, I always say green juices, because that's going to get all the nutrients right to your cells and bypassing digestion, and even steamed vegetables or soups. So soft foods that, are going to bring in a lot of nutrition. And I know it seems counterintuitive, but really staying hydrated, right? Because it's like, if you think about it, you're going to be going to the bathroom all the time anyway, but let's get you hydrated. And maybe, in addition to cranberry juice, you're bringing in some like lemon balm tea, which is really antibacterial and antiviral, or hibiscus tea. It's that same color as cranberry. You could make a big batch of it and keep it in the fridge. And so then instead of just water, you're ingesting this healing tonic that's like, helping to, move things through and calm things down. So because really what we want to do is we want to flush out the bacteria that's causing the pain and discomfort. And that's what I think that the root cause is. And, in my in the nutrition courses that I offer, it's nourishing foods to help heal your pelvic pain, and the creating a healthy gut course. I talk a lot about, what to eat and what to remove to reduce inflammation. And in the gut course, I really focus on supplements to bring in, because there's a lot of herbs out there that people don't know about. Cat's claw is another one. Cat's claw is like this herb or this bark, and they make it into a tincture, and that can help reduce not only symptoms of painful bladder symptoms, but it can also helps with the Herxmeyer, or what I call a healing reaction. What happens when we start to experience die-off symptoms of the pathogens that are in our bodies that are causing the problems. But even just bringing in a few supplements, right? Or a few teas, in addition to removing or reducing inflammatory foods, can make a huge difference in, in somebody that wants to improve their symptoms.
Yeah, that's all really interesting. Some of these herbs I've never heard about, but I think that would be something good to incorporate into a regimen or a routine, which is always something I tell my patients, that, you don't have to cut everything out necessarily, because we also don't want you sitting at home, wishing you could eat something constantly and nothing good is in your diet. But definitely additions are good, addition of herbs and anti-inflammatory teas. And you mentioned tea a few times, and I know a common question that we get from our patients is caffeine. So what's your take on caffeine and interstitial cystitis?
Yeah, so I think if you're healing from anything, I feel like caffeine has to go. But I know that's hard for people. They love their coffee. So my suggestion is to drink the best of the best, right? I mean, I know that especially for interstitial cystitis, caffeine isn't going to be your friend, especially when you're having to go to the bathroom already. Like, I would just suggest removing it while you're healing, right? It's like, if we can just look at the way we're eating as, I want to heal something in my body right now, and I'm just going to give this up for now to allow my healing to happen, doesn't mean you can't ever have it again, right? So I always, because I know that it feels scary, like, oh, I'm getting rid of this, and it's, we have an emotional attachment to different foods and beverages. So, and what I like to recommend is what I call transition foods. So it's, instead of giving up your hot beverage in the morning, well, what can we drink instead? Maybe it is a hot tea, or maybe it's some chaga mushroom, which tastes really earthy and coffee-like, and has so many medicinal properties. And I know that Dr. Millspaugh is always talking about different medicinal mushrooms to include, and they all have different fun properties about them. But like a little bit of chaga, it's like an extract, it's like a powder, and you add hot water to it, so it's like tea. But then you can add your almond milk or coconut milk and make a little latte out of it. So or you drink it black if that's how you drink your coffee. So I always suggest just, while you're healing, shifting to something that's going to support your healing instead of, lead to inflammation. But it's the teas I'm referring to, they're always herbal, so they're always uncaffeinated.
Right. Right. And I also liked what you said about the water, because that's something that, I try to emphasize to my patients. It seems very contradictory when, I'll have a lot of patients that'll say, well, I have to go to the bathroom so much that I've cut down on what water I'm drinking, the amount of water I'm drinking. And unfortunately, that actually worsens the symptoms. And we always say that worsens the symptoms of not just interstitial cystitis, but of pelvic floor dysfunction in general, because as you dehydrate the bladder lining, you're irritating all the muscles, you're dehydrating those, and those muscles are just going to become spastic and tight and angry, and that blood flow is not really going to get to where it needs to go to really heal that bladder. And so I always stress, drinking, Monique, I don't know what the amount you say is, but I usually say drink half your body weight in ounces. So, example is if you're 100 pounds, drink at least 50 ounces of water a day. And if you're more active, if you're athletic, that would even go up more than just half of your body weight. So what are your guidelines on drinking water?
Yeah, I think that that's a good guideline for people, because I feel like people need a guideline or they don't remember to drink enough, right? Of course, they always say, 8 cups a day, but like you said, depending on your activity level, you might need more, or if you're a smaller person, you may need less. I like to add things to water to make them more, to make it more of an electrolyte drink. So adding fresh lemon or lime or orange or even just like cucumbers to water can, it allows the cells to, suck in more nourishment. Whereas a lot of times if it's just water that doesn't have, and drinking high quality water too. So we want to make sure that we're drinking, filtered water. We get a lot of toxicity just drinking tap water. So, choosing a good filter water, but then, making it alive again by adding some freshly squeezed lemon juice to it, really will allow the body to actually pull in those nutrients and hydrate the body better. And I also really love coconut water. So sometimes I'll add a little bit of coconut water to like half regular water. And I feel like that's another great way to like really hydrate the body versus just doing regular water itself. So there's like little tricks to, and it makes the water taste better, right? So it's like, ooh, it's kind of sweet. You can also add like a teaspoon of raw honey to filtered water, and that creates an electrolyte drink. So again, it's like nourishing the cells instead of, if it's just what I call dead water, sometimes the body doesn't absorb just regular water. So we need to add some electrolyte to it. So those are some good tricks to help the body really get more hydrated. And again, make it taste better and be a more enjoyable experience.
Yeah, definitely. Thanks for that answer. That was a very enlightening answer. I didn't know about a lot of those things you could add to water. And also I assumed coconut water was hydrating, but I didn't know about the potassium relating to the interstitial cystitis. So, it's not harmful in any way or can't exacerbate those burning symptoms?
I think it's different for each individual, but I think mixing the coconut water with water, like cutting it with water, could make a difference too, instead of just straight coconut water. But I'm still a fan of of the cranberry juice and diluting that with water. Like filling up a 4-cup mason jar, like a quart-sized mason jar with like 1/4 a cup of cranberry juice and the rest with water. That can be helpful. Or even just like if somebody made a concentrated hibiscus tea, right? They could do 1/4 of the hibiscus tea and fill that with water. Add lemon to it, add honey to it. Because that color, the red, the pink, like that helps in the healing of that area.
Okay. And so we always talk about food as medicine for healing inflammation. But in this world of instant gratification, medicines work faster in terms of providing that temporary relief. But when we're talking about, healing from the inside out with anti-inflammatory foods and adding all these additions you've talked about, how long do you usually tell your patients that, if you start making these changes, how long would you expect to see any results or any improvement in your symptoms?
Yeah, that's a great question. And I feel like it definitely depends on the individual, and it definitely depends on what they're removing and what they're bringing in, right? So, somebody that's eating a high inflammatory diet but adds herbs may not experience results right away, right? Because there's just not enough changes being had, and there's too much inflammation. But somebody that is reducing the inflammatory foods and, bringing in more anti-inflammatory stuff, like all the green stuff, and then also introducing a few of the supplements that I suggested, they'll feel results within a couple days.
Right.
So it can be really powerful to change your diet. But yeah, I usually say a couple days to a week, people usually start feeling a lot better.
Wow. That was faster than I expected.
Yeah.
Well, do you have any other points that, we're not going over here, or any other?
I feel like we covered everything. I just want to mention that if anybody is, curious about how to change their diet, that I'd highly recommend signing up for one of our nutrition courses. It's kind of like a 6-week crash course in how to do it and how to start feeling better. And of course, I'm always here available one-on-one if anybody wants to get personalized care. So yeah, then I think we have a few questions that popped up there.
Yeah. Let me kind of go back. Oh, here we go. Did you say that too much potassium can aggravate interstitial cystitis? So from my standpoint, Monique said you can dilute the coconut water, which is a great idea. We do say that any high potassium diet, or really any diet high in any element or any entity, is going to, exacerbate inflammation. So moderation is always key. High potassium foods like bananas and dates and coconuts, we tell you to, as Monique was saying, dilute them or eat them in moderation. But potassium directly does not impact interstitial cystitis. It's just there's some research out there that shows that too much potassium can sometimes increase burning with urination or just the inflammation around that bladder. But I would highly recommend, if you are eating a lot of foods rich in potassium, that's something you would want to run by in a course like Monique offers, or ask a nutritionist, because they can help you kind of regulate the amounts of all of these different elements you're taking in.
Yeah. And most of the time I find that, people aren't eating a whole bunch of bananas and dates and coconut water all at the same time, right? Usually right. People are rotating these foods in their diet. So again, it's just, and I always recommend people keep a food diary or a food journal and pay attention to how you feel afterwards. Like, 30 minutes after drinking something, did you have more pain urinating, right? Like, that's important to know. And then, oh, maybe that beverage isn't for me, right? Mm-hmm. And so there's no one answer for everybody. It's trial and error and just experimenting on ourselves. And that's how, because our bodies want to heal and they have the answers. So, I encourage anybody that's feeling frustrated with their symptoms to really have compassion for yourself and don't give up. Keep experimenting and having fun with food, because you will find the foods that make you feel good. I promise.
Definitely. And remember, food is medicine. And I think that even as an allopathic physician, who also has a background in functional medicine, I think that, medications and injections and other treatments will definitely help you get to your goal of having a good quality of life. But I think healing from the inside out is really going to give you that long-term relief. And that's why we say food and what you put in your body is directly impacting what you're feeling. So, Monique, can you just give us a really quick rundown on, if somebody is interested in your course or your nutritional consults, where they can find more information on that?
Yeah. So on our website, pelvicrehabilitationmedicine.com, you can go to courses and you can sign up directly to one of our courses. And I believe you can also go through the website to inquire about working with me directly.
Great. Yeah. And same website, you can find us. So if you are having, urinary symptoms and pain with urination and these interstitial cystitis-like signs and symptoms, and if you have seen a gynecologist or a urologist and can't quite figure out what's going on with that pelvic floor region, that's kind of where we come in as pelvic floor physiatrists. So pelvic rehabilitation, .com, you can find all of us, the nutritionists, the physicians, and find more holistic care to kind of tackle this interstitial cystitis. So yeah, thank you so much.
We also have behavioral health and an awesome course called Retrain Your Pelvic Pain, and just taking those in tandem with going to see a physiatrist and like doing the nutrition. It's really a multidisciplinary approach that we find really helps patients heal.
Yes, because when you're living in chronic pain, it really impacts that nervous system. And it's kind of like your nervous system is always sitting on the edge of its seat, ready to fight. And so that's where our behavioral therapists really come in and help ease that nervous system, calm it down, bring it back to baseline, as well as heal from internally a nutritional standpoint. So
exactly.
All the resources,
Yeah, well, this was great. Thank you so much.
Yeah, thank you. And sorry for the technical difficulties at the beginning, but feel free to contact either Monique or myself if anybody has other questions. And it was great talking to you.
You too. Have a wonderful day.
You too. Thanks so much. Bye.